Welcome back to Taking Charge of My Cancer podcast, episode 78. I have with me a really special guest, Kerry Lenius. Kerry completed her undergrad degree at the University of Central Florida and her master's degree and PhD at Florida State University. She has published 2 book chapters, 5 peer-reviewed articles, and completed numerous presentations. Following completion of her PhD, she returned to clinical work and now has over 20 years of experience working with adult medical population. She is actually a speech pathologist, and her current area of focus is in the head and neck and voice cancer and voice disorders. She leads a support group of 4 individuals with aphasia and is in the board of directors for Lary's Speakeasy laryngectomy support group. So Larry, Gary, thank you for being with me today. I really appreciate you being my guest.
My pleasure.
So tell me a little bit about your role and were you always planning to do this?
Yeah, so as a speech pathologist, I help people with both communication and swallowing problems. And I help them really to get to the best they can be, getting back to whatever they love. I did always, in a way, I guess, plan to do this in some respects because when I was in high school, I declared my major in speech pathology and I never changed majors, which is pretty unusual. So I went all the way through. I worked for a few years after my master's and then I went back for a PhD. And my dissertation work was with head and neck cancer and swallowing. So I guess this is where I'm meant to be and I'm very happy doing it.
That's great. You want to tell me a little bit about the Larry's Speakeasy laryngectomy support group? What is all that about?
Yeah, sure. It's a really large online support community for individuals who've had a total laryngectomy. So, we have the piece of the pie that's head and neck cancer out of all cancers, and then there's a smaller piece of the pie that has laryngeal cancer in their voice box, and not all of them have the surgery, but some of them have a surgery called a total laryngectomy. So it is a small amount of people, I guess you could think of it, in the United States. However, we do that surgery a lot here at the University of Florida. So this, I didn't start this organization. It was started by someone who had a total laryngectomy himself and was running the group for a few years before he asked me to be on the board of directors. But I've been on that board ever since, and it's a group, like I said, we give support, but also they collect laryngectomy supplies, which can, for some people, be hard to get depending on their insurance. And those get donated to the organization and then get distributed for free for people who need them. So, yeah.
Got you. So will you explain a little bit in a head and neck cancer situation? And I know can be multiple types of head and neck cancer, but what is your role as a speech pathologist? Like sometimes when we were seeing patients pre-op, prior to surgery for like, any type of like, oropharyngeal or hypopharyngeal type of cancer, they were like, yeah, we were seeing them for a baseline measures and they were seeing you. You want to just kind of explain to the audience a little bit, how is your role on that pre-op, then post-op, and then, what is that so important for patients to know that they should be going and ask, advocate for themselves and ask their ENTs if they're not referring to you, why it's so important to do that.
Sure. So you specifically said, pre-op and post-op, and then we also see patients pre-radiation, and then during radiation and after radiation as needed. So pre-op for radiation is a little different in that we do have some research behind doing some evidence-based exercises before people develop swallowing problems to try to help prevent those. So we educate them on that. We get a baseline of how their swallowing is functioning, and it's a great time to educate them on how the swallowing mechanism works. Usually with our radiation only folks, they don't have a lot of speech impairments from the radiation other than maybe trismus, the jaw opening. For our surgical candidates, that's a different story. So for the pre-op for surgical, we're getting again a baseline of how they're speaking and swallowing, but also able to go through some expectations of recovery, what that might look like. They'll typically have at least a temporary feeding tube for a length of time while they're healing because they just had surgery to their mouth or throat. And then what that recovery may look like as far as progressing back to talking again and swallowing again. So that's kind of what we do pre-op. And then post-operatively, it's just really dependent on where the patient is. Some people, if they're not having a large resection, it may be a very quick recovery. Other people have their entire tongue removed, let's say, and that's gonna, take longer. So that really varies.
Okay. Sometimes patients, or I come across some patients, who ask, well, I don't know what is the importance of this swallow test. I just cough and I'll be okay. And I don't really need to swallow certain type of foods. I just gonna go drink and then I'll be okay. Will you explain a little bit more about what is the implications of having some issues with swallowing?
Sure, sure. So for swallowing, the main health risks that we see for people who have difficulty swallowing are food and liquid going into their lungs, which can collect in the lungs. And if your body's not able to work it off, it can cause infection in the lung, leading to pneumonia. So that's one, thing that we, of course, are concerned about. But another is malnutrition and dehydration. So even if you can swallow, but you can only swallow a little bit, it's a lot of work. If you don't have another way to get nutrition, then you're likely to get dehydrated and malnourished, and that can delay healing. So say you had surgery, or even with radiation, you need to heal from those things. So if you don't have that nutrition, that's going to be a barrier in multiple ways. So those are, I guess, those are really the two big things.
Okay, great. What good resources would you advise patients to look into it to educate themselves?
Yeah. So there's so much in the age of the internet now. So starting just with a website that I think is good for people listening to this to maybe look up is that the National Cancer Institute has a really great patient. It's kind of like a patient portal almost, and they have a lot of really easy to understand material, including the material on the caregiver, the role of the caregiver. So that's something you can check out. And I don't know, Durley, if you post notes or anything after this, I can send you some links that you can put with it. As far as apps, right? There's an app for that. For communication specifically after head and neck cancer, when it can be really hard to talk if someone's not understanding you and you're writing things down. Sometimes we do use communication devices that are like an app, right? So in the age of that, Speech Assistant is the app that I tend to recommend to my patients who've had head and neck cancer because it's really easy to use, and you can program certain things that you want to say, but you can also type it and then it will say it out loud for you. So that, I think it used to be free, but I think it's like $10 now. So it's a fairly low cost app that is a good one for communication. And then there's support groups on Facebook. You asked earlier about Lary's Speakeasy. So that's certainly one way people can connect with other people who've had a similar surgery. And then I'm also a member, I'm not on the board, but there's a group that is a little wider based, in that it's Survivors of Head and Neck Cancer is the name of that group. So if you're somebody listening to this and you think, well, I didn't have a laryngectomy, but I had, another type of head and neck cancer, that might be something you check out.
Perfect. That's very valuable. Um, how about any three valuable tips that you can give to a patient who is having issues with head and neck cancer from your professional standpoint?
Yeah. So I would say the first one is to find support because it's really easy to feel alone. And you are not the only person that has had this radiation. You are not the only person that's had this surgery. As clinicians, Darlie and I see it all the time, but you don't see our patients, so you don't know them. So finding a way to get resources, whether it's a live support group or virtual or something online, of course, you have to take everything with a grain of salt. They are not your doctors if they're giving you advice, but just knowing somebody's been through that too, it's really can be very helpful. And for caregivers too, caregiver support. So I think that would be one tip is to seek that. Another tip for my head and neck folks is to push yourself. So when you're going through radiation, you're not going to feel like eating, but we don't want those muscles to waste away. So you have to push yourself and you have to do it even though it doesn't feel good. It doesn't taste good. Maybe you're nauseous. Same with post-surgical. So after surgery, we do try to be aggressive. Durley asked earlier about complications from swallowing. And yes, there are health complications that can happen. So you have to work with your speech pathologist. But anything you can be swallowing, you should be swallowing and practicing because that is the best type of exercise you can have is actually doing that task. And then for the third one, I would just say to be kind to yourself. It is easy to think, oh gosh, a baby could do this, or oh, this should be so easy. Well, no, you just had something major happen to you, and it's going to take a while to get back to what you can do to get for some people it's faster, but find every small advancement that you've made and celebrate that. You know, it's not okay, I'm here and I have to be there and I'm not going to be happy till I'm there. You know, celebrate each step along the way and be kind to yourself.
That's really good. I'm so glad you say that because sometimes I see both ways, right? I see the patients who push to the point that they're really going up and then they're going downhill. You have patients who, yeah, they continue doing and they do really well. And then you have patients who really start just no eating at all from the beginning. And some like, I have like maybe a couple of cases that after radiation, they have to go back to surgery to dilate their throat because everything closed down. So I always tell them, we give them all this education about radiation fibrosis and how that will not only happen on the outside, but happen in the inside. So it's great that they're with us in physical therapy, where we're doing a lot of manual therapy, working on their neck and working on their tissue. But if they are not using those throat muscles, when they swallow, then how is that going to get stretched? So I really tell them, try to really do as much solace as you can, as push as far as you can. If by week 3, 4, when everything is really not that great, then you can go down into your soft food, and then maybe at the end you only can do fluids. But sometimes patients start just with fluids from the beginning, and that's not great. This is something that they're going to be looking for trouble later on. So that's important. Sometimes as well, I advise them to everything is going to be like a regimen, like you say. Things doesn't taste well, so eating is not a good thing anymore, right? Because you don't have appetite, things doesn't taste well, your throat hurts, so you really need to eat for survival. So just really listen to the doctors. If they tell you, take this pain medication, it's because you should do it, and I'm somebody who does not like to take pain medication, doesn't like to take medication, but this is a time where you may want to do that. So get into your routine to do your mouthwash, numb your mouth, so take your pain medication, eat 3 hours later, do the same. So you can really try to get through this process without having to end up having to putting in your stomach to keep you, with the right weight and so forth. So glad that you kind of mentioned some of that. What is a common questions that you find oncology patients ask you?
So many different questions, but I think maybe a common theme is getting at when will I be back to normal? When will I be able to do everything I did when I was 20 years old, right? So, um, and that's hard because sometimes that's not realistic. In that um, if you've had your leg removed, you wouldn't expect a new leg to grow, right? So there's some similarity in that if you have your tongue completely removed, and there's tissue from your arm or your leg in there, it's not going to act like a new tongue. So certainly my role is to still work with you. It doesn't mean we're not going to do therapy. We are going to do therapy and there is going to be improvement, but it's not probably going to look the way it did before your surgery. It is a life-changing surgery. So that can take a long time sometimes for people to wrap their heads around, and everyone's different, and it takes time for you to kind of find your new normal. So there's not a timeline on it. Certainly, you know, we look to see a good amount of progress in that first year, but you know, anyone at any point can do something one day that they couldn't do the day before. So.
Okay, great. Um, we know that a lot of our head and neck patients that end up having lymph nodes taken out of their neck develop this condition called lymphedema, which is swelling of their neck or their face. And then as a certified lymphedema therapist, you know, a lot of us work on getting all that lymphedema under control and helping you with different techniques like manual lymphatic drainage and some garments and so forth to try to help with that. But many times the patients don't see what happened inside, right? So they say, well, I have this lymphedema and you're helping me with all this, but I don't need to be doing my speech stuff because that's not going to help me, you know, or my speech exercise because that's not going to help me. But I would like for you to explain such a huge role, how this is going to affect your mechanism of swallowing when you have lymphedema.
Okay, so first off, Durley, they don't say that to me. They're saying that to you, and that might be the truth, is that they don't think they need to do their speech exercises, but when they come see me, they're like, oh yes, I'm doing them. I'm doing them all. So we get a different story. But yeah, so as you said, there's external and internal lymphedema. So it's very visible, easy to see when it's exterior, but we can see when we do X-ray swallow studies, you know, we can see the swelling internally as well. So it is important to be moving those structures. If you're not moving structures in your mouth and in your throat, then how is that fluid going to be draining? So that gets back to keep swallowing. When you swallow, you're squeezing muscles all the way down, and that helps with draining of fluid. Did that answer your question? Was there more to that question?
No, that was great. Yeah, because it's amazing how much this fascia can be created by internal lymphedema. And like you say, I cannot see that, right? So if I have a patient who comes with lymphedema and let's pretend they saw you or any speech pathologist pre-op, post-op, but never follow up again because their speech therapist say, no, you can swallow, you're good, you have a normal swallowing, see you later, you don't need me anymore. And then they come to us developing with lymphedema, and you know, I know that whatever we do externally is helping internally, but we don't have a way to know what's happening internal if it's not based on the testing that you guys do for swallows. So how common is for these patients, or how can they go and go back to the speech therapist or somebody like, you know, that because you're in this environment, but how many institutions out there, they'll say, well, I don't need to do this again because you have a normal swallow. So why should I do this again? So I just don't know how the patient that is having issues with swallowing can go back to you guys to try to get, you know, a fluoroscopy to see, okay, what's happening internally. Is this happening or no, it's not happening?
Sure. And I think it also goes down to the functional problem. So if someone maybe has some lymphedema internally, but they're not complaining of trouble swallowing, their swallow mechanism is working well, then they're going to be eating and drinking because they have to live. So that is, you know, something that can help with the lymphedema, but they don't have a functional problem. Now, on the other hand, many of our people do have functional problems, and a lot of times there's things they can be doing at home. So even if they're, well, I can't come and see the speech pathologist all the time, well, certainly we set people up very commonly with what they can be practicing at home. So being able to do that on their own and be independent with it, and be able to manage that. If it's, say more minor, but they are having some difficulty because of that internal lymphedema.
Perfect, perfect. That's very helpful to know. What book recommendations do you have for the audience and why?
Yes, so this one is specific to total laryngectomy. So I hope some people watch this or listen to this that have had a total laryngectomy. But there is a very nice man who has had a total laryngectomy who is also a pediatrician. And he wrote a book. Let's see, it is called Dr. Brooks is his name, and it is called The Laryngectomy Guide, and it is free, and it is in 18 languages.
Wow.
So you can find it online. You would type The Laryngectomy Guide, type that in Google, Dr. Brooks, and it will come up. And you can download the free version, or if you want it in print, you can order it from Amazon. I've read it. There's a lot of great information, and it's coming from a doctor, so it's information that's backed by science.
Perfect. Thank you for that. And like I said, I will put those as well on the show notes so people have easy access to it. How about any podcasts?
So this podcast, of course, right? A lot of podcasts are, if you're looking for cancer related podcasts, there might be very, very broad to lots of types of cancer. So since I work with head and neck cancer, I'm just gonna maybe give a shout out for something head and neck specific.
Yeah.
So the Head and Neck Cancer Alliance is a great organization that, of course, as the name implies, is specific to head and neck cancer. And they have, and we can put this in the notes as well, a podcasts and articles link on their site. And that will take you to specific podcast episodes that are related to head and neck cancer. And most of those are people that are somewhat famous that have had head and neck cancer talking about their journey. So I think that would maybe be of interest to our listeners. So
That's great.
there you go.
That's excellent. That's very good. I don't know if you have the opportunity to listen. One of my patients actually was on this podcast with a total laryngectomy with his wife.
I did. That's how I first found out about your podcast. They sent me the link so I could listen to it.
Yes,
Yeah, because I worked with him
that
as
was
well.
one of the more fun episodes I have done. And I think, I don't know if it was, help them with like an app where I wanted to hear his voice because he has like the amazing personality. And so I was like, it was nice to have like, even though people couldn't hear his voice, at least through the app, because they was able to, answer the questions. And I think that has been helping a lot of the patients in the past or other survivors that I've been interviewing. It's kind of like a closing. I don't know if it's closing a chapter. It's just another. When you get to tell the story, kind of help you with the healing process of going through this journey. I don't know what it is, but if every one of them has been saying like feel like a release, like, oh my God, I feel so much better. I'm so glad I did that. I'm so glad I can help other people that is going or like when the same situation I went through or what I'm going through. And it's such a nice kind of like feeling. So for me, I love it to hear like, when you're telling the story, you are on the other end. I have patients who are going through the story and then it's like, okay, I'm just going through this, but help them as well to deal with everything that comes along with it. So yeah, so that has been great. So it's great. Thank you for that information on the book. What it means to advocate for yourself and how can people do that?
How to advocate for yourself as a patient, you
Yeah.
mean through healthcare
Yeah.
or?
Yeah.
Okay. So I think one way maybe is thinking, as a speech pathologist, of course, I'm going to kind of direct things that way. Is number one, access to care, right? So if at UF Health, we are spoiled in that we have a lot of specialties here, but in rural settings, there might not be a laryngologist. There might be an ear, nose, and throat, or an otolaryngologist who does ears and nose and throat and kind of a little bit of everything. But some of our patients need something more specialized, and that is why a lot of people, for example, come to UF Health for the laryngectomy surgery, because it is a very big surgery, very specific. So advocating for, well, maybe I need to go somewhere else, or hey, I need the specialist. And, you know, a lot of people don't know there's a laryngologist, and that's different than an otolaryngologist, right? So that would be one way to advocate, is to kind of find out what specialty providers to see, as well as access to being able to have therapy services. A lot of our people come from far away, so they struggle to find therapy services in their area. So I offer services here, but I also encourage them, because they can go much more often, to seek someone in their area, which sometimes is hard because head and neck cancer therapists are not on every corner. So it can be hard to find somebody. And it is important to find somebody that is comfortable with the types of issues that you're dealing with. So that's another source of advocating to get that right type of professional. And then on a totally different note, but advocating for yourself when you have communication problems, right? So as a speech pathologist, we often are working with people who they can't answer the phone to schedule their appointment. So being able to find other ways, scheduling through my chart, or having email access, or at least having, when possible, a family member that can call and schedule, because sometimes people are lost to follow up for the simple reason of not being able to call.
Yeah.
And that's really unfortunate, because we do want, to be able to follow up.
That's great. That's great advice. The other thing as well, sometimes I come across is the story in the beginning, right? So how many times you hear from patients, well, how this whole thing start? Well, no, I have a little sore throat. I went to my primary care and they gave me antibiotics, and that didn't go away. Still having the same pain. Come back, second round of antibiotics. Didn't go away. Then I went to urgent care and they look at again, a third way of antibiotics. So it's like, and nobody really looking further into that. So again, advocating for yourself means I went one round, that did not work. I want to see the specialist. This is not just a sore throat. And mainly if you have a history, or you're a smoker, or you can have a little bit of a high risk to develop head and neck cancer. That's super important, because we know that the early they can find it, the less morbidity for surgery is going to be, right? Versus it's different to take a little piece of tumor from somewhere versus just wait until you have to end up having a full total laryngectomy because the extent of the tumor. So it's really
That's
important.
a great point. Yeah. And thinking of it from that advocating before you're even diagnosed, don't miss an appointment with your dentist.
Yes.
Many of our tongue and lip, jaw cancers are found during a regular dental exam.
Yep. Yeah, that's great. That's perfect. And then as well, I have heard some stories of like dentists who not necessarily looking at that, right? So you just kind of go for a cleaning and that's all they see is the teeth, right? They don't look beyond, that area, which sometimes is sad. But again, always don't be bad if you go to the dentist and they look at your teeth and they're like, oh, were you not looking at my tongue? Why are not, so don't feel bad to ask them questions. You're not judging them. You're just, again, is your health, is your body. You're paying for a service, one or the other way. Just ask them, what about this and what about that? Or, if you go into an emergency room because you have difficulties breathing, and you just, seeing a physician who perhaps is like, no, you will be fine, whatever. It's like, well, no, 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 I'm not gonna be fine. Are you gonna do further testing? You're not gonna discharge me until I'm satisfied for what you're telling me. It's not like you try to tell them what to do, but unfortunately, the health system now is becoming that if you don't have the knowledge, sometimes a lot of things get misdiagnosed because they're just packed in the emergency rooms and the amount of stress and the amount of things that happen. So sometimes you just have to just be there and then read about it and ask questions and get second opinions and then just don't believe everything unfortunately one person is telling you because it's you just gotta read. And if you have a physician who gets upset because you're looking for a second opinion, then you better get another physician because this is actually a good physician always will say that. Go for a second opinion. I'll be happy to, send the information around or whatever happens. So yeah, so don't be afraid to ask. How can people find you? And I'll put those as well on the show notes.
Yeah, well, I work here at UF Health, as my background shows, for where if you can see me. And I'm in speech pathology, so that's where to find me personally. But as far as I mentioned, I alluded to earlier, finding a speech pathologist in your area, right? That's probably, kind of what you might be thinking too. Like, yeah, that's great, but, and someone might be listening to this podcast in Michigan and think, I can't go to Florida, right? So, I don't know that there's a head and neck specific one, but I know there's at least a laryngectomy one. Lary does Speakeasy on our website. We do have a link for providers and all of the speech pathologists. You can go to your state and see who works with that population. And if a speech pathologist works with total laryngectomy, they probably also work with other head and neck cancers. So even if you've had a tongue cancer or a jaw cancer, and you're looking for a speech pathologist, you could look at that Lary Speakeasy list of providers because that would still give you a good idea.
That's great. Is anything that you have of value for our audience that I have not been asking you?
I don't know. I don't think so. You do this so long, it's hard to remember what people might just not know because it's like second nature. So I think you hit on the big things, and I'm happy if anyone listens to this and they want to email me and have a question. They are welcome to. It's leniuk@shans.ufl.edu, and we can put that on the notes as well.
Perfect. Oh, one more thing that I just thought. In regarding speech, so we've been talking a lot about swallowing, but in regarding the speech, so if you have patients with partial glossectomies, which for the audience, that means that just a piece of the tongue is being taken out, not the whole tongue. Um, how can you help them to improve their speech? Because that's one thing that they get frustrated, right? I cannot get people to understand what I'm saying. So
Yeah, so like when you were talking about lymphedema, how the fluid fills up in the mouth, if someone's had maybe just a little piece of the tongue removed, that's cut out, and then there's usually scar tissue there, and it might make the tongue look a little different, not move as well. So we see that a lot. Or if it's a larger amount of the tongue that's taken out, there may be a flap, so a piece of arm or leg that is now in the mouth. So I do a lot of manual work. So I work in the mouth. Not all speech pathologists do, but in the mouth to try to break up some of that scar tissue. And the lymphedema can be in the tongue, in the mouth as well. So working on moving that through, working inside the mouth. As well as I teach patients how to kind of stretch the tongue themselves, kind of how much to do, how much not to do. Certainly you want to assure that you've had some healing time first. So you definitely want to ask your healthcare provider before starting something like that. And then we also work on compensatory strategies for how we articulate. We work on because the tongue is huge for talking, and we have a lot of these cases where a small part of the tongue is removed, and people can understand me, but I don't really sound the same. So we work on precision and teaching where the tongue goes for certain sounds and trying to be able to reach the tongue to that place and get the agility with the tongue to have a clearer speech. I've had several people that I've worked with that are going back to work, maybe have high demand professions such as physicians, that when they talk to patients, they want to be articulate. So that is definitely an area we also work in.
Great. Well, Kerry, all this was amazing. Thank you so much for the amount of information. I think that you really bring a great value to our audience, and then hopefully people can reach out to you if they have more questions. But thank you again for doing this with me.
You're welcome. Thank you for inviting me.
Okay, absolutely. Have a great rest of the afternoon.
You too.
Bye.